What are non-invasive treatments for stress incontinence, SUI? Imagine being able to improve bladder control without surgery or implants. That's what non-invasive treatments for stress urinary incontinence aim to do. Stress incontinence happens when activities like coughing, sneezing, or exercising cause urine leakage because the pelvic floor muscles are weak or not supporting the bladder properly. The good news is that many effective options focus on strengthening and supporting these muscles naturally and safely. One of the most common approaches is pelvic floor muscle training, often called Kegel exercises. These involve repeatedly contracting and relaxing the muscles that support the bladder and urethra. With consistent practice, many people see a reduction in leakage, sometimes even complete improvement. Using biofeedback devices can make these exercises more effective by showing real-time feedback, helping ensure you're engaging the right muscles correctly. Lifestyle changes also play a big role. Adjusting fluid intake by reducing caffeine and alcohol can lessen bladder irritation. Managing body weight is important because excess weight puts more pressure on the bladder and pelvic muscles. Eating a high-fiber diet helps prevent constipation, which can increase abdominal pressure and worsen incontinence. Even modest weight loss can make a noticeable difference in symptoms. Bladder retraining is another helpful method. It involves scheduled voiding and delaying urination to train the bladder to hold urine longer and reduce urgency and leakage episodes. This behavioral approach can be combined with other therapies for better results. Emerging non-invasive treatments include energy-based therapies like radiofrequency and laser treatments. These procedures use controlled heat to stimulate collagen production in the vaginal or urethral tissues, which helps tighten and strengthen the support structures. These treatments are usually done in a doctor's office, requiring no anesthesia, and have minimal side effects. For example, devices that use cryogen-cooled radiofrequency or non-ablative lasers have shown promising results in improving symptoms by enhancing tissue support and muscle function. Biofeedback devices, such as the Hue and Joy system, provide targeted pelvic floor training with real-time feedback, helping users learn correct muscle engagement. Many patients find these tools improve their symptoms significantly and enjoy high satisfaction levels without invasive procedures. These non-invasive options are considered first-line treatments because they are safe, supported by clinical evidence, and can be tailored to individual needs. Surgery is generally reserved for cases where conservative methods do not provide enough relief or if symptoms are severe. From a bladder health perspective, these treatments help maintain the natural function and support of the bladder and urethra without the risks associated with surgery. For individuals with bladder conditions like bladder cancer, avoiding invasive procedures when possible is especially important, and these therapies can be a good option when appropriate. Always remember, it's essential to consult healthcare professionals who specialize in pelvic health or urology. They can assess your specific situation and recommend the most suitable non-invasive treatments. Consistent practice of exercises, lifestyle modifications, and following medical advice can lead to meaningful improvements and better quality of life.